Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Welcome to the Friendly Pharmacist podcast. I'm your host, Nario Cantu, and today we're diving deep into a topic that I believe is critical not just for pharmacists, but for patients, healthcare professionals, and the entire medical community. We all know pharmacists as the people behind the counter, the professionals who dispense medications and ensure prescriptions are filled correctly. But let's be clear. Pharmacists do so much more than count pills and print labels. In today's evolving healthcare landscape, pharmacists have stepped into vital roles that extend well beyond the pharmacy counter, roles that significantly impact patient health outcomes, medication safety, and overall wellness. So let's explore how pharmacists contribute to patient care beyond dispensing medications. We'll cover key aspects such as patient education, medication therapy management, and collaborative care. By the end of this episode, I hope you'll walk away with a greater appreciation for the vital role pharmacists play in healthcare today. One of the most underrated aspects of pharmacy practice is patient education. When a patient walks into a pharmacy, they're not just picking up a bottle of pills. They're often picking up a treatment plan, a potential solution to a health issue, or a new regimen that will affect their quality of life. But here's the thing, medications are only as effective as a patient's ability to use them correctly. That's where pharmacists step in. We educate patients on how to take their medications, potential side effects, and interactions with other drugs, foods, or even supplements. This education is not just a courtesy, it's a necessity. Poor medication adherence is a huge issue, leading to preventable hospitalizations and even fatalities. When a pharmacist takes the time to explain the why behind a medication, how it works, and what to watch out for, patients are more likely to take it correctly and experience better health outcomes. But patient education goes beyond prescriptions. Many pharmacists now offer education on over-the-counter medications, chronic disease management, lifestyle changes, immunizations, and more. Some even provide smoking cessation programs, diabetes counseling, and nutritional guidance. This knowledge-sharing aspect of our profession is crucial in bridging gaps in healthcare access and ensuring that patients receive the guidance they need to make informed health decisions. Medication therapy management, or MTM, is another area where pharmacists shine. Think of MTM as a comprehensive, personalized approach to medication management. It's not just about filling a prescription. It's about looking at the big picture of a patient's medication regimen and ensuring everything is working together harmoniously. Through MTM services, pharmacists review a patient's medication profile, checking for potential drug interactions, duplicate therapies, and cost-effective alternatives. For example, let's say a patient is taking multiple medications for high blood pressure. A pharmacist conducting an MTM session may notice that 2 of those drugs are from the same class and are essentially redundant. By working with the patient's physician, the pharmacist can suggest a streamlined, more effective, and potentially less expensive regimen. MTM also plays a vital role in medication adherence. Patients who struggle with taking their medications as prescribed, whether due to cost, side effects, or simple forgetfulness, benefit from pharmacist-led interventions. We can recommend adherence strategies like medication synchronization, reminder systems, or even switching to long-acting formulations when appropriate. In essence, MTM allows pharmacists to proactively identify and resolve medication-related problems before they escalate into serious health issues. And the best part? Studies have shown that MTM reduces hospitalizations, improves chronic disease management, and even cuts healthcare costs in the long run. Now let's talk about one of the most exciting developments in pharmacy, collaborative care. Gone are the days when pharmacists worked in isolation, simply dispensing medications without much interaction with other healthcare providers. Today, pharmacists are increasingly being integrated into patient care teams, working alongside doctors, nurses, and other healthcare professionals to provide comprehensive, coordinated care. One great example of this is the management of chronic diseases like diabetes, hypertension, and asthma. Pharmacists, often the most accessible healthcare providers, can monitor a patient's condition, adjust medications in accordance with protocol agreements, and provide lifestyle counseling. Some states even allow pharmacists to prescribe certain medications under collaborative practice agreements, expanding their role even further. Another area where pharmacists are making a significant impact is transitions of care. When a patient is discharged from the hospital, they're often sent home with new medications, dosage changes, or instructions that can be overwhelming. Pharmacists help bridge this gap by reviewing discharge medications, counseling patients and caregivers, and ensuring a smooth transition that minimizes the risk of readmission. And let's not forget telepharmacy. The rise of telemedicine has also opened new doors for pharmacists to provide virtual consultations, medication counseling, and remote monitoring. This innovation is particularly valuable for patients in rural or underserved areas where healthcare access is limited. As we wrap up today's episode, I want to leave you with this thought. Pharmacists are an undervalued yet essential part of the healthcare system. We are not just dispensers of medication. We are educators, problem solvers, and patient advocates. Whether it's through patient education, medication therapy management, or collaborative care, pharmacists play a crucial role in ensuring safe, effective, and personalized treatment for millions of patients. The next time you step into a pharmacy, I encourage you to see your pharmacist as more than just someone who hands you a prescription bag. They are healthcare professionals with the knowledge, expertise, and dedication to help you achieve better health. Thank you for tuning in to the Friendly Pharmacist podcast. If you found this discussion valuable, please subscribe, leave a review, and share it with others who may benefit. And remember, your pharmacist is here to help beyond the counter and beyond the prescription pad. Until next time, stay informed, stay healthy, and as always, stay friendly